Very good afternoon to all. I am Dr. Rutra Mohan from IIP Digital Team. Be handling the host controls are Dr. P. Senthil and Dr. Kumresa. This webinar is being streamed live on IIP India YouTube channel. I request all to subscribe to this channel for notification for live webinars. You can also follow IIP updates on social media platforms such as Facebook, Twitter, Instagram, and LinkedIn. The organizing team for today's IIP Women's Cell Kanchipuram district, Tamil Nadu. Okay. Now I request Dr. Pradeep to go.
Warm welcome to all. Good afternoon again. I'm Dr. Pradipa from Indian Association of Physiotherapists Women's Cell, Tamil Nadu, Kanchipuram District Coordinator. First of all, I would like to thank Dr. Sanjeev our Indian Association of under the theme of World Physiotherapy Member Organization for this 2023 year. I would like to welcome our resource persons for this webinar. Welcome you all, sir, and welcome all the participants too. I'd like to hand over to Dr. Chandralekha, Sub-Coordinator, Kanchipuram District, IAPWC Tamil Nadu, to introduce our resource persons for the webinar.
Thank you, Pradeepa ma'am. Good morning to everyone. It's my pleasure to welcome Dr. P. Senthil Kumar sir, specialization in MPT Cardio PhD. Sir is a Dean and Professor, Chettinad School of Physiotherapy, Chettinad Academy of Research and Education, Chennai, Kelambakam. Sir have academic experience in 17 years, research excellence in posture analysis and corrections, neck syndrome and non-specific low backache, tool development and its corrective exercise strategy. Sir has published n number of publications, more than 50, and copyrights in 4. Sir has received many special awards as name of Young Researcher Award 2022, Outstanding Researcher in Physiotherapy, Venus International Foundation, September 2018, Distinguished Service Award 15th Annual Conference of IAP, Bangalore, February 2019, Supremacy Award, Physio Troops 2021 Conference, December 2021, Alumni Excellence Award, Stride 2022, Outstanding Excellence in Physiotherapy, Global Healthcare and Wellness Conference, November 2022. Outstanding Achievement in Physiotherapy, PhysioCon 2023. Sir have other remarkable awards, presented oral paper in many national and international conferences, received Best and Oral Presentation Award in 2014. PhD scholar guiding sir 7 members, MPT students guided more than 20, delivered more than 15 innovative lectures. Sir, I am welcoming you, sir. We are pleasure to having you in this webinar, sir. Over to you, sir.
Thank you so much, Madam, Dr. Chandralekha, Madam. First of all, I would like to wish us World Physiotherapy Day to all the participants and the organizer. I would also like to thank the Central IAP, Indian Association of Physiotherapists, President Dr. Sanjeev Jha, and Secretary Dr. Ruchi Vashni, and IAP Women's Cell Chairperson, Tamil Nadu, Dr. Janani, and the Kanchipuram District Coordinators, Dr. Pradeepa and Dr. Chandralekha, and the other participants and the resource person, Dr. Kumresu sir. So it is an immense pleasure to me to be here for this webinar about the day of World Physiotherapy Day celebration with the theme of arthritis. and its physiotherapy management. So here I would like to give a 20 minutes of talk about the osteoarthritis, many forms of arthritis, and particularly about the osteoarthritis and its prevention strategy. Followed by that, the management strategy will be given by Dr. Kumaresan sir. Just I'll share the screen. Madam, I am audible?
Yes, sir, you are audible.
Okay, madam. Screen is visible, madam?
Yes, sir.
Today, my topic is insight about arthritis and its prevention. So first we will see about arthritis. What do you mean by arthritis? Arthritis means, it's in general term, inflammation or swelling of one or more joints. There are more than 100 conditions which produce arthritis. The major part of the joint structure surrounding soft tissues and connective tissues will be involved during this inflammation. The specific symptoms will be there for each cause, but general, the patient will be complaining of joint pain and stiffness, which is a very more common problem. Just I'm going to highlight different types of arthritis. There are more than 100 we have been told in the introduction. But some of the few very commonest arthritis like ankylosing spondylitis, gout, psoriatic arthritis. So these three categories will be more common in male. Whereas in case of rheumatoid arthritis, osteoarthritis, patellofemoral arthritis, very common in females. Sometimes in both the gender, reactive arthritis will be there at any age group. Even idiopathic arthritis, especially in case of juvenile, more chance of idiopathic arthritis after a sudden fever or infection. So these are some of the few examples for the arthritis, which is more prone as an inflammatory process in the joints. Here I want to highlight the images of normal joint and the osteoarthritis. What happens to the joint structure, which is more involved, especially in the osteoarthritis, because I'm just going to narrow down the webinar about the osteoarthritis alone. There are different types of more than 100 arthritis. One among them is a osteoarthritis. In the image, just you see the normal joint. We all know about the muscle, bursa, bone, cartilage. This is a blue color, which is been few millimeter in thickness, which surrounds the articular surface of the joint structure, and it is been surrounded by the synovium, and synovial lining will be there. Inside synovial fluid will be there, which has been again reinforced by the joint capsule and the tendons so safely. Whereas in case of osteoarthritis, just you see here the articular cartilage which winds the surface of the joints has been damaged, wear and tear has been formed, which causes the joint space to narrow down. This is the best example of osteoarthritis, and which is been classified based on the severity. Different symptoms are also be produced. If you see in the microscopic level, the articular cartilage has been zoomed, where we have been seeing superficial zone, transitional zone, and deep zone. Between the bone and the cartilage, the lining is called as tide mark. After the tide mark, the subchondral bone will be there, followed by the subchondral bone, cancellous bone will be there. So this few millimeter of articular cartilage, which forms the three layers of superficial zone, transitional zone, and deep zone, which will slowly go for erosion, damages, wear and tear, due to repeated strain or multiple causes, which we will see in later slide, which produces the osteoarthritis. So this is a general image, and this is going to be the microscopic view how the alignment of the articular cartilage. We need to know about the structure and which structure has been involved before entering into the depth of the condition. Now we will move on to the osteoarthritis. What do you mean by osteoarthritis? It's a degenerative disease. With the degradation of articular cartilage in the joints, where we have just now seen the articular cartilage, which goes for degradation. It is the most common type of arthritis, more common in older people, but nowadays it is predicted more in younger group also because of lack of physical activity. I have taken this image from the author Katz et al. He given a clear picture about the disease elements. He classified the disease elements or the damages of the osteoarthritis based on the anatomical, molecular, physiological, structural changes which produces illness and joint failure. Again, he given some example also how this osteoarthritis damages happens when this anatomical aspect or molecular aspect or physiological aspect of changes happens in the articular cartilage. Example, the cartilage and soft tissue degradation, osteophytes, synovial inflammation, all this comes under anatomical structure. Molecular, in the molecular aspect, the collagen 2 COMP aggregants, which causes more damages at the molecular level. Physiological aspect, cartilage stain, wear and tear, which comes under the physiological happenings in the damages in the articular cartilage, which produces the osteoarthritis. So this is a simple classification of the disease based on the segment, based on the joint illness, and thereby which produces the joint failure. So once again, I'll repeat the definition for osteoarthritis. It's a degenerative disease with the degradation of articular cartilage in the joints. Another conceptual model of osteoarthritis taken from EM and Arden NK in 2015, Rose EM and Arden NK 2015 from the Nature Review Rheumatology journal, where they talked about the strategy for prevention of knee osteoarthritis. They given a conceptual model of OA knee, what is the major systemic factor and the mechanical factor which predispose to this osteoarthritis. Thereby, what are the happenings, disease or illness happens to the person. First, you take the systemic factors. Here comes the age, gender, obesity, inactivity, which is very, very important for the younger people, which causes the osteoarthritis, and the genetical changes also, which is an unchangeable, but whereas the other varieties which can be modifiable. So the mechanical factors, for example, for mechanical factor, it's obesity, more of BMI, weight gain, and joint morphology and alignment because of nature of the job, strain, the alignment which changes, and joint loading, muscle weakness, injury. All this majorly predispose as a mechanical factor for the osteoarthritis. So it is a disease of whole person, susceptibility of joints to damage or failure of repair. We all know that once that articular cartilage has been damaged, wear and tear has been occurred, it will not repair. That is important. Till now, the research says that there is no any tissue or any model, artificial model, which replaces that few millimeter thickness of the articular cartilage. The immediate remedy for the total damages or more the severe damages of the knee joint or any joint, articular cartilage, which they will go prefer for the knee replacement. So the prevention strategy is very, very important. Such a way we can prevent from this more the severity or damages to the articular cartilage as earlier reduction, and thereby we can able to manage the self ability of the individual. Here, the same from the Nature Reviews Rheumatology, they given a clear picture of how to prevent the osteoarthritis at the initial stage. So they're given as a 3 categories: susceptible individuals, early disease or minor joint impairment, late and end stage disease, or ultimate joint failure. So categorizing the individuals into these 3 major groups, how it can be detected, can be clinically detected, and through the identification of high risk group, through the biochemical markers, sensitive imaging markers, and the markers progression, or through our assessment evaluation, we can biomechanically analyze the joint levers, alignment of the joint levers, joint loading. So all this, even food sensor, everything will give a clear picture about this stages of the disease. Through the different stages, we can initiate as a primary prevention, secondary prevention, and tertiary prevention based on the stages of the individual. This images has been taken from the Rose E. M. and Arden N. K. et al. And as I said, that Katz et al. Are given a clear definition how to prevent the osteoarthritis as based on the primary prevention. Here they mention it as primary prevention means there is no disease or no illness. Whereas in case of secondary prevention, subclinical disease started now initially, but no illness. Tertiary prevention, already the clinically signs are there, disease illness started to produce. Some damages happens in the structure. That shows the tertiary prevention level. So based on all these categories of severity or the disease, we can go with the prevention strategy. So primary prevention. The goal at the pre-disease stage is to promote health through education on healthy lifestyle choices and specific prevention against the infection of disease by modifying the risk factors in favorable direction. We have already seen some of the mechanical factors, riskier factors, which predispose to the osteoarthritis. That can be modified through a proper education to the people in the society. Some modes of health education can be implemented through diet, exercise, and a healthy lifestyle. Today, the primary prevention play a major role. We identify some of the riskier factors or riskier population in a particular group, insist them, give them a proper education that the more chance are there if you have been going in future, the osteoarthritis has more happenings, a chance of osteoarthritis. For that particular targeted population, you go with a diet management. In case, you take an example of obesity. In case of obesity, we can predict them that more chance of damages because of the articular cartilage because due to more loading. And in case even if you take occupational related, sitting prolonged, that can also produce more chance of wear and tear osteoarthritis since the imbibition of circulation will be reduced with the prolonged sitting. So for all this, proper diet control, exercises, and the healthy lifestyle is very important. Even at the work environment, workspace, they can try to do some sort of stretching, move here and there, on and off, avoid prolonged sitting. So all this do's and don'ts about the osteoarthritis can make them more improvement in the primary prevention level. And also I remember that we also learn and insist the patients or this strategy, primary prevention level, make them to do sit in the floor, make them to do Indian toileting, advise them to do sit and do whatever the activities. So a full squatting and the floor sitting definitely make them on and off. They are doing more the flexibility of the cartilage and circulation of the cartilage will be improved through the sinus fluid movement. So which has been forgotten now, and we have been in a modern lifestyle. So simple Indian toileting, sitting in the floor and eating, all this has been forgotten. And even for females, some home activities which has been in the floor level, that has been forgotten, which traditional way of doing activities which make them good at the earlier primary prevention level. Secondary prevention. Here it's a subclinical stage. Again, you narrow down, go with a more targeted population. For example, a sports person is there, a policeman is there, traffic policeman is there, who is going to stand along more. A sports person need to stay in more the knee, but of a riskier factor. So you target that population, more the chances of injury can happen. After the injury, how they can be prevented. After crossing certain age, definitely wear and tear will be there, how they can be able to manage so that further worsening of the damages can be prevented. Best example for this secondary level of prevention is advise some braces, supports while walking, while standing for a geriatric population who is having some illness, having some injury predisposed population, such a way that will reduce the workload. Even you can advise some sort of a small exercises, strengthening program, which makes the knee joint so comfortable and loading can be reduced through the muscle strengthening. Thereby the muscle weakness can be improved through some sort of exercises, which play a major role in the secondary prevention category. Next, we will move on to the tertiary prevention. Here, in the tertiary prevention, we have been identified the osteoarthritis population. We have noticed that they are having some problem because of the osteoarthritis. Disease has been proven, and because of that, some symptoms have been started. Not able to do certain activity, having pain because of that difficulty. So in this case, maximum we need to provide a good treatment aspect strategy, thereby prevent its progression to disability or worsening to the severity level. This is the main target we need to set as in the tertiary prevention level. Then this includes maximizing the remaining capabilities and function. Whatever available, we just provide and make them good, such a way to provide a good ADL. First comes here is a pain management, symptom control, stress relief. Even we have been studied that not only the physical, even the mental changes, disturbance can also aggravate the damages or a pain sensory input during the degradation of wear and tear conditions. So the stress relief also play a major role, and disease management, how to manage the disease. Yes, the osteoarthritis came, but how to cope up their activities through this reducing the symptoms. And a proper rehabilitation where the physiotherapists play a major role and make them subjects to do independent life along with some assistive device or supportive instrument with a proper structured exercise. So all this make them to be independent. And another important here area is risk reduction. So whoever kinesophobia can also happen as the disease progress. They are not able to move because they will have some balance or neuromuscular changes happens, loss of sensory input, proper sensory input. Thereby they can go for any time fall. So all this will again worsen the condition. So this risk reduction will also play a major role. You need to give them a proper counseling, make them to do their proper exercises, daily exercises, go for a diet conscious. Even a study says that if they reduce the weight, 50% of them can prolong the occurrence of osteoarthritis. It's a very, very important. So only it is very common in female because of their hormonal imbalance and more of obese. Osteoarthritis is very common in female. So we can target the population, make them to reduce the weight such a way, at least we can prolong 50% of the occurrence, till we can reduce the occurrence. So this is a very important area where the tertiary prevention, the physiotherapists play a major role through some sort of implementation of structured protocol. Here I given some example for neuromuscular exercises. I don't want to speak more about the therapy because the next speaker is going to speak about the management strategy. So this simple exercises, joint positioning sense, which can be promoted, daily routine cycling, strengthening, simple joint movement exercise, squatting, all flexibility exercise, stretching exercise are some of the components which helps to maintain the joint range as well as the muscle in a good position, and it will reduce the severity. So thank you so much for giving this wonderful opportunity. Once again, I would like to thank IAP President Dr. Sanjeev Jha and the Secretary Dr. Ruchi Varshini and all the IAP Women's Health Coordinators of Tamil Nadu and Kanchipuram district for giving me this wonderful opportunity. Thank you so much. I hope so. I given a small picture about the prevention strategy in osteoarthritis, but it is a very vast topic, so which can be detailed. We can study in maybe in a future session. Thank you so much.
Thank you, sir. Thank you, sir. It was wonderful explanation about the arthritis. Thank you so much, sir. I'm over to Pradeepa, madam.
Thank you, sir. That was a wonderful session. Thanks a lot. Hope everyone would have received some knowledge how to prevent osteoarthritis. Thank you, sir. Next, I will College of Physiotherapy. Having in full-time teaching faculty in Savita College of Physiotherapy about 14.3 years, guiding PhD scholars in this field of physiotherapy as per the demand globally. PhD already completed students are 3 scholars and guiding at present 8 scholars. Research Council member and Research Alliance structure, examiner and doctorate community member for various universities in India. And sir is also NABH coordinator for physiotherapy department, Savita Medical College, and NAC inspection. Sir is one of the important member, and sir is a member of IQAC and Board of Studies in Savita College of Physiotherapy, and academic audit committee member in Wales College of Physiotherapy, Vistas, and Savita College of Physiotherapy. Member of Faculty Selection Committee in Wales College of Physiotherapy and NIPMET, handling 150-200 inpatients and outpatients every day in the Department of Physiotherapy. Sir is an editor and author of 10 book chapters. Totally 1 or 2 research publications, science indexed 9 and 15 and indexed 38. There is a 3 patents filling done on Australian government. Patent title is Autism Disorder Prediction using Deep Learning Approach, and patent number. Automated diagnosis. patent filing
Yeah.
done on Indian government
கால் வந்துச்சுன்னா
title diagnosis
காப்பாச்சு அது எங்க இன்டர்னல் இல்லைன்னா நான் வந்துட்டு சொல்றேன்
ஓபிஏ இதுதான் நான் போகணுமா
It's up to you. உனக்கு என்ன instruction
Parkinson's disease. Chandra, one copyright filled in the topic of recent trends dysphagia, physiotherapy management. Then 6 awards, Mentor and Student Supporter Award in the first international conference IAP Madurai chapter and received Professional Excellence Award on First World Physiotherapy Congress Spring 18 at Vagdevi College of Physiotherapy, Telangana. Sir received a Best Teacher Award in 2018 and Vinayaka Mission University and received Significant Contribution Award in 2020 at 58th Annual Conference of Indian Association of Physiotherapy held at Chennai. Received Significant Professional Achievement Award in IHCon by Manswell Healthcare Academy, Chennai, and received Distinguished Young Professor Award from Novel Research Academy, Puducherry. Sir has received Academy of Excellence for his noble work in CME on Global Tech Advancement Physiotherapy, a view held on 2nd April 2023, organized by Pro Physio Edu Researcher Award of the Year in Stride International Conference held at 5th April 2023 from Momentology Academy at Chennai. Sir has 2 international grants of patent title Autism Disorder Prediction Using Deep Learning Approach and received INTI seed grant on proposal titles Effects of Proprioceptive Training on Neck Pain Intensity, Joint Position Sense and Functional Performance among non-specific neck pain desk job workers with kinesiophobia. As the author of fund receiving amounting of RM 20,000. Sir, that's a great work, sir. Hats off to you for this much dedication towards the profession. Welcome you, sir.
Thank you, ma'am. Thank you so much.
Yes, sir.
Shall I start, ma'am?
Yes, sir. Sure, sir. You can proceed, sir.
Good afternoon, everyone.
Good afternoon, sir.
Yes. Is it visible, ma'am? Everyone?
Yes, sir. Yes, sir.
Good afternoon, everyone. First of all, I will thank our mentor, Dr. Sanjeev Jha, sir, and our IAP President, Ruchi, ma'am, Kanjipuram District IAP Women Cell President, Pradeepa, ma'am. Thank you for this wonderful opportunity, ma'am. And I have to thank my college also, principal and management, other faculty members. Attending this faculty members and students attending this wonderful webinar. My topic is unlocking mobility, the latest breakthrough in arthritis physiotherapy. No, unlocking mobility is because of the arthritis. If any problem is there in the arthritis, any joint, as sir said, previous speaker, Senthil sir said that many joints are affected. N number of arthritis is there. If it is affected, definitely the joint mobility is lost. This is unlocking mobility. And what the breakthrough therapies are there. That is what we are going to see in this half an hour session. Introduction. Arthritis is a group of disorders or symptoms that includes pain, stiffness, joint deformity, and subsequent to an inflammatory process. Arthritis is a pervasive and debilitating condition that affects million people worldwide. There is no, as the physiotherapist role, there is no cure of arthritis. Only we can manage the condition, helping the patient regain and maintain their mobility and alleviating the symptoms. In recent
Hi everyone. I think Derek, kindly wait.
Sorry, ma'am.
Welcome, sir. Welcome back,
Issue,
sir.
ma'am.
There is some
Sorry, ma'am.
internet problem with this
Yes,
Airtel,
ma'am.
I think. Yes, sir. You
Yes,
can
ma'am.
continue, sir.
There is a traditional physiotherapy, but even though in recent years there is a arthritic physiotherapy has witnessed a remarkable breakthrough that offer renewed hope and improved outcome for individuals battling this chronic ailment. Now we can see about the prevalence of osteoarthritis. It's nearly 9 point. The worldwide WHO has given the data December 22 last year. Nearly 9.6% of men, 18% of women aged over 60 years suffer from osteoarthritis worldwide. In India, osteoarthritis is a common and it's more frequent joint disease in the country with prevalence of 22% to 39% is affected in India level. These are the types of osteoarthritis. You know, osteoarthritis already, as our previous speaker said, about many arthritis is there. In that, degenerative disease osteoarthritis is the most common. So mainly the gender-wise, if you are taken, these are the things definitely as a physiotherapist you want to know. This information is very necessary to us to treat patient of osteoarthritis. Even gender, females are more affected. Obesity people is having a more degenerative disease arthritis and repetitive stress overload over the joint area. Syndromes. Overusing of over that particular joint, definitely they will affect wear and tear at the particular joint and osteoarthritis occurs. Some of the grafting sound also is coming, like a popping sound or crackling sound is coming in that when you are. Am I audible? Ma'am, am I audible, ma'am?
Yes, sir. Yes, sir. Carry on.
Joint space narrowing also is there in osteoarthritis. Next, we can go for.
Sir, can you share your screen, sir?
not visible, ma'am.
Sir.
Ma'am, it's not
Yes, sir.
visible.
Yes, sir, you can carry on, sir.
Post-traumatic arthritis, because of any injury, any fracture or dislocation, definitely after few years, there is a arthritis is occurs in that particular joint. There are degraded of particular cartilage because of the usage of the particular joint. Degraded medial, this is the degraded medial meniscus also is occurs. See, because of any traumatic injury, definitely after few years, they will get osteoarthritis. Even young age people also is affected. See, according to the prevalence rate, 5 million people in every year worldwide, they are affected in the post-traumatic arthritis. See, next is psoriatic arthritis, ankylosing spondylitis. Psoriatic arthritis, definitely these are the clinical features is present along with painful joint. Eye inflammation is there, swallowing fingers and toes. With crumbling nails are present, even skin rashes also is present, heel pain and foot pain. Definitely the bilateral or unilateral it's affected. Ankylosing spondylitis, only there is initial stage, the inflammation is occurs. After the inflammation, it's fused of the spinal vertebrae like a bamboo spine. Okay, this is also one of the arthritis. Rheumatoid arthritis, all the other soft tissue, everything is affected in rheumatoid arthritis because it's a chronic inflammatory disease. So rheumatoid arthritis, even bursitis is there, tendinitis is there, erosion of articular cartilage, synovitis, inflammation of the subchondral bone, everything is affected. You have to treat all the structure, intra-articular and extra-articular structure, both you have to treat in these conditions. Gout arthritis, because of the uric acid level is increased in the blood level. So you will get gout arthritis. This is affected on the smaller joint, maximum in the first metatarsal joint. Septic arthritis, if any inflammatory joint disorder where bacteria or other microorganism enter the joint cavity and cause of infection, it may affect any joint in the body, but hip, knee, shoulder joints are mostly affected because of the weight-bearing areas. Weight-bearing joints are mostly affected in septic arthritis. Juvenile idiopathic arthritis, it's along with fever, the children having a 1 to 2 years is the most common and prevalence rate. Generalized lymphadenopathy is present, cirrhosis, hepatomegaly, splenomegaly, and arthritis. Arthritis may be in the knee joint, ankle joint, anything along with the rashes also is present in idiopathic arthritis. See, whatever the arthritis is there, definitely these are the symptoms is present. With that symptoms, we have formulate the problem list. After your assessment, you have to formulate the problem list. After your problem list, you can set the goal, and according to the goals, you have to do the physiotherapy management. Symptom pain is a major problem, and swelling, redness, warmth in the joint because of the inflammation. These are the commonest signs and symptom is present in the joint. Stiffness or reduced movement of the joint. The stiffness is present in the early morning. After following exercise, sometimes they feel stiffness of the joint. For example, if they are getting up from the chair, getting up from the sofa, or getting up from the room, definitely they feel stiffness of that particular joint. They can reduce the range of motion also is present. See, subjective examination, clear-cut patient history and interview is very important, because without subjective examination, as a physiotherapist management, we cannot go for subjective and objective examination. You should know the subjective and objective examination, then only you can go for identify the problem list, then you can treat the patient. Patient history and interview, it's very carefully you have to take. What are the, for example, if osteoarthritis of knee is there, patellofemoral arthritis is there, tibiofemoral arthritis is there. If in subjective itself, you can collect the data, whether climbing upstairs they will have a pain, or climbing downstairs they will have pain. These are the interpretation from the subjective examination we can get. These are the interpretation whether that particular joint is getting loaded or unloaded. Like that, we have to ask the patient. Pain assessment, characteristics of pain, nature of pain, and depth of pain. Many things are there. whether it should be a intermittent or continuous pain, intermittent pain. These are the things is coming under whether it should be a mechanical type of pain or in the inflammatory type of pain. Inflammatory type of pain, definitely they will have continuous pain, or mechanical pain, on and off pain will be there, and even the symptom also sometimes reduced. Whenever they will do the work, then only they will have pain. Other than that, inflammatory pain, they will have a continuous pain. On objective examination, if you are treating that particular orthotic joint, you have to observe whether swelling is there or not, any deformity is present, the build of the patient, posture of the patient, everything should assess. Along with the palpatory method, you can go for tenderness and muscle warmth and muscle structure and orientation. Also, you have to assess surrounding the musculature present along with the joint. Examination, assessment, range of motion assessment. In that, osteokinematics also you have to assess. Arthrokinematics is nothing but joint play movement. If joint play movement is reduced, definitely the range of motion also will be reduced. So you have to assess joint play movement like spinning, rolling, sliding. These are the movement also you have to assess. Assessment of muscle power and endurance you have to check. The muscle growth is very important, because surrounding musculature, if it is strength, then only the patient having a good joint strength. Otherwise, it's very difficult. Joint proprioception, whether they will have a kinesthetic sensation or not, whether that particular joint is moving, that particular range of motion is there or not, that you have to check. Then only they can able to maintain the balance and coordination. So you have to, if it is affected proprioception, so you have to assess balance and coordination also. See, these are the functional tests, performance-based functional tests also you have to assess in arthritic condition. See, like a 6-minute walk test, 12-minute walk test, or get up and go test. These are the functional tests you ask the patient to do. Then you can grade it according to that. Psychosocial assessment, you have to check, because the chronic illness is there. Definitely they will get a problem in mental health, including anxiety, depression. Some coping mechanism also should be related to the arthritis we can treat, so that you have to check mental health also along with the patient social support. According to the ICF classification, we are going to see impairment, activity limitation, and participation restriction. Each and every condition, whatever the participation restriction is there in the social level, that you have to assess. According to that, you have to treat the patient, so that the patient quality of life also will be become normal. These are the patient. Next is patient goals and expectation. You have to discuss with the patient goals. What are the goals and expectation from the physiotherapist? That you have to ensure that patient what they are expecting from us, that you have to assess, and according to that you have to set the goal. That goal should be a realistic one, tailored to the patient needs and preferences. Madam, am I going very fast, madam?
It's okay, sir.
Okay. Next, we can go for investigation and interpretation through artificial intelligence. See, if you are using nowadays, artificial intelligence is the technology development is there. Even this one is entered to the healthcare system also, healthcare management system also. So we can go for interpretation by artificial intelligence. These are the X-rays, the electrophysiological data, electroimaging data, everything we can go for interpretation through artificial intelligence. See, this is the radiographic analysis of ONE. See, in this, everything should be calculated. We cannot, qualitatively, we cannot say joint phase. We cannot say qualitatively, we can say quantitatively. That is what nowadays we are using artificial intelligence. How many mm is reduced, how much what are the subchondral bone size, what are the restriction is there. If you are doing a passive movement, or if you want to bring back the normal range of motion, how much it's expectable range, everything should be clearly, it's given by artificial intelligence. Data-driven assessment, artificial intelligence analyzes the interpretation of the data from various sources such as wearable sensors, motion capture systems, video recording. See, once these are the facilities, if it is there, we can assess along with that the joint movement pattern, how much joint load is there, what are the movement is they are doing improper or proper movement is there or not, whether balancedly they are walking or imbalancedly they are walking, everything should be assessed by wearable sensor and motion capture system video recording assessment. All the data-driven assessment providing objective measurements, not only the qualitative analysis, it should be given a quantitative analysis, the patient strength, weakness, and progress, helping the physiotherapist to make informed decision about the treatment also. Even these are the predictable assessment. It will be useful for how much range you are going to produce that particular joint, what are the pain limits, everything should be assessed by AI. So it will be used for your PT management easily to the patient. See, these are the wearable sensors. Sensors is there, smart glasses, smart watch, smart shirt, and Bluetooth key tracker, smart shoes, smart socks, smart pants, belts, ring, fingers, bracelets. Okay, these are the smart wearables are there, devices. If the person can wear these things, the person should be called as digitalized human or human, the sensor enhanced human body. See, after that, we have to enter to the patient to sensory room. That means the specialized room. You ask the patient to walk, then you can assess biomechanically what are the range of motion is attained that particular joint, whether loading is there or not properly. Everything we can assess with use of these wearable devices. See, this is one example, objective movement assessment. See, once the wearable electronic to the patient, if they are wearing, it's called as a digital human. There, how much loading response is there in that particular point, particular leg. Okay, then that is also we can assess what are the muscle strength is there, how much they are walking, everything should be patterning and mining work is there. So each and every cell should be assessed with use of the wearable sensors. This is the biomechanical assessment of once the sensor enhanced body enter to the visual room. Automatically, it should be notable development in arthritic physiotherapy. Its use of biomechanical assessment. These assessments should be scrutinized the patient movement pattern, identify any abnormalities is there, may exerable joint stress. Should be a physiotherapist. These information should be gets from the through the physiotherapist. Develop targeted intervention to correct these movement imbalances, so that with use of that, reducing the pain, improving the mobility is more precise and efficient manner. Okay, this is one example of postural correction mechanism after wearable sensors. The pelvis angle should be how much tilted is there. Pelvis angle is shifted. Even shoulder also is not properly level also is not properly there. And knee rotators is working more. Hip rotation is occurs here. Ankle drop, okay, is present. So that the weight bearing also is affected. How much weight bearing is there, each normal leg and affected leg, everything should be calculated. According to that, we have to treat the patient. Okay, this is one of the assessment of postural mechanism. The pain, next we can go for normal pain management strategies. What are the things is used already? The heat and cold therapy, which is used for as such physiotherapist. Pharmacological, non-pharmacological therapy is there. In that, we are going to see non-pharmacological therapy. Heat and cold therapy. Heat and cold therapy, we have a many modalities are there. Shortwave diathermy, wax therapy, and heating pad, everything we can use. Cold therapy, many method is there. In that, whether that particular source of problem is needed, what kind of treatment that you have to assess, and according to that you have to give. See, for example, if deeper penetration is there, you want to treat, you can go for long wave diathermy and ultrasound therapy. If superficial effect, superficial articular structures are affected, extra articular structures are affected, then you can go for shortwave diathermy or wax therapy. You can go. Okay, like that you have to see, choose the electrotherapy modalities and restrict and alleviating the pain. Physiotherapists use various techniques such as joint mobilization and soft tissue mobilization to reduce the pain and stiffness in affected joint. Okay, next we can go for joint mobility and flexibility. Physiotherapist aims to restore, improve the joint mobility. We can go for active range of motion. If active range of motion is not there, we can go for active assisted range of motion. Active assisted range of motion also is not possible. You can go for passive range of motion. Along with that, whether any restriction is there, a bony prominence restriction or spasm restriction, and whatever the restriction is there, we can go that according to that treatment. Stretching exercises also we can give. It should be prevent the contracture and maintain the joint function. Strengthening exercise. If the strength of the muscle, strengthening exercise is designed to improve the strength of the muscles around the affected joint, providing better support to give the stability of that particular joint. Stronger muscles can help reduces the joint stress so that the pain also will be reduced. Posture and body mechanics. Physiotherapists educate the patient to proper posture and body mechanics to minimize the joint strain during daily activities. This learning to move, lift objects correctly can help further prevent further joint damage. See, for example, if knee joint is affected, we ask the patient to bend with use of the knee bending activity. If it is back pain is there, to ask the patient to knee bending activity, you can lift the object from the ground. Like that, we can ask the patient to do. Squatting should be avoided in the osteoarthritis knee. These are the things you have to educate to the patient related to the posture and body mechanics. Assistive devices. Physiotherapists can assess need for assistive devices like canes, braces, or orthotics and provide training for their proper use to reduce the pain and improve the mobility. See, this is the one elbow joint brace. Elbow joint brace, how much if it is any arthritis is there, for example, rheumatoid arthritis also, or any arthritis, end range should be prevented so that the bone-to-bone contact will be avoided, so that the brace will be used. Like that, assistive devices also is used to reduces the pain and improve the mobility. Activity modification. Physiotherapists help to patient identify that exacerbate their symptoms and provide guidance on modifying or adapting those activities, so that they can also suggest alternative method, joint-friendly exercises and activities. You cannot give all the joints should be weight-bearing exercises. Even free exercise also should be taught to the patient, ask the patient to do, maintain the joint range of motion, particular arthritic joint. Patient education is very important. Then only they can able to do the lifestyle modification also. I think prevention part, as sir said, education is very important about the condition, about the treatment. For arthritic patients, the patient learns self-management techniques, are empowered to take control of their particular conditions. So that education is very important about the condition, about the treatment to the patient. Pain coping strategies. If any problem is there in the pain, we can ask the patient to do some relaxation technique, mindfulness yoga, and it will help to the patient to better manage for chronic arthritic pain. Long-term maintenance, it should be, everything should be long-term maintenance so that they can able to alive or maintain the quality of life with use of the these are the techniques. Whatever we can see, this is everything is whatever followed regularly as a physiotherapist. Individuals with chronic arthritis, physiotherapy can provide ongoing support to maintain the joint health, managing the pain and prevent further deterioration of the joint. See, pre-operative and post-operative rehabilitation also is there. It will be improve the joint function, reduces pain, enhance the overall well-being. And after the post-operative condition, we can ask the patient to do lifestyle modification also, along with the medications, and other healthcare intervention also should be provided, and they should follow. Then only they can able to maintain the quality of life. They can able to do their own ideal activities. Psychosocial support. Coping with arthritis can be emotionally challenged, so that we have to encourage the patient to do the exercises and motivating the patient, managing the how to manage the stress, anxiety, depression. This is everything should be taught to the patient. So these are the factors can affect the experience of pain and overall quality of life. See, now we can go for breakthrough therapies in arthritic physiotherapy. These are some newer techniques collected from the recent literature views. Biologics which is used to inject that particular area over that particular arthritis. For example, rheumatoid arthritis condition is there. We can inject biologics, some drugs. These are the drugs which is used for reduces the pain, and it won't be affected other other some normal healthy tissues also. Okay, it won't be affected. So that we can ask the patient to, this is orthopedic specialization, whoever did, they can do the biologics to that particular point. Telephysiotherapy after COVID-19, we can use telephysiotherapy is very important role as a physiotherapist. Online physiotherapy protocol, we can do some in front of the screen, we can do some exercises, ask the patient to do in the home itself. The physiotherapy services remotely, ensuring continuity care during times when in-person visits may be limited. It has not only provided convenience, but also expanded access to physiotherapy for those in remote areas or with mobility limitations. So telephysiotherapy is very important role to continue the physiotherapy. Those who cannot able to access to the clinic or the therapist also, even time-saving method also, we can use this via telephysiotherapy, teleconsultations. Tailored exercise program. Physiotherapists are increasingly using personalized exercise program based on the individual specific type and severity of arthritis. These programs can be include strength training, flexibility exercises, low impact activities like swimming, cycling to improve joint function and reduces pain. See, in this tailored exercise program, we can use artificial intelligence, one of the major machine learning. See, if you are all the data should be uploaded to the artificial intelligence or machine learning, automatically it can give your exercise prescription, how much strength you have to do, how much flexibility joint, flexibility exercise, how much range you have to produce, everything it should be prescribed to you. See, this is what now recently it's happening in the many countries, Western countries. Assistive devices and technology. I told already the wearable devices, smartphone, apps empower patients to monitor their progress and receive real-time feedback, enhancing their adherence to prescribed exercise routines. These tools not only the tracking progress, but also motivate individuals to stay on track with their physiotherapy program, resulting in more positive outcomes. See, in this picture, we can give some smartphones also, like chatbot and wearable devices. If you are using motion capturing system in their home, you can check what are the exercises you have to prescribe. Everything you can sit with in the clinic, you can ask the patient to do. Virtual reality or augmented reality technologies are being explored as a tool for pain management and rehabilitation exercise. They can engage the patient in immersive real-time scenario. If it is immersive method, real world, what the real-time scenario, real-time world, they can face whatever the problem is there. According to that, you can use the distraction of the pain also is there. Activities on promoting joint mobility and muscle strength with use of the VR and AR. Aquatic therapy. Aquatic therapy is a water-based therapy. With that, the patient can enjoy it easily. They can able to do the exercises. Buoyancy of water reduces the impact on the joint. making it easier for individuals with arthritis to perform exercises, either cycling or walking, whatever it may be. Even warm water also will be used to, it will be helpful to relax the muscle and reduces the pain. Manual therapy, many techniques are there. This is also, it will be helpful for arthritic conditions and soft tissue mobilization. Many advanced technique, cupping therapy, needling, many things are there. Okay, everything should be used for not only the arthritis, because of the arthritis, whatever the secondary complications, that particular surrounding muscles should be treated. It can improve the joint mobility and reduces the pain for arthritic patients. Body mind therapies, I already told, the yoga therapies, yoga, mindfulness yoga, meditation, these are the things helpful for psychological aspects of the arthritis. This is reducing the stress, can have a positive impact on the pain perception and overall well-being. Nutritional guidelines. See, in this picture, whatever they can able to eat for rheumatoid arthritis patient is there. Like that, each and every arthritis we have things. See, one more thing, if it is a purines, the gout arthritis, we cannot, we should not advise that whatever the purine content food should be avoided. Like that, the rheumatoid arthritis patient also can able to use fruits, lean proteins, omega-3 fatty acid, cherries and berries, beans, ginger, green tea, turmeric. Okay, these are the things should be used to eat. Many things should be avoided: alcohol, dairy product, omega-6 fatty acid, refined sugars. These are the things should be avoided, so that it will worsen the pain. Biomechanical test training. This involves teaching individuals with arthritis how to move more efficiently and reduce joint stress during daily activities. See, once enhanced digital human body should be entered to the visualized area, the motion capture area room. They can able to easily identify whether loading is proper or not, that the joint is placed properly or not. Even training also we can do with that. This can be help to improve the function and reduce the risk of injury. You can alternate in this, whatever the muscle is imbalanced is there, that particular muscle could be goes to the strengthening activity. Next, we can go for conclusion. The latest breakthrough in arthritis physiotherapy represents beacon of hope for individual living with this chronic condition. From personalized treatment plans and advanced therapeutic techniques to assistive devices, pain management strategy, biomechanical assessment, telephysiotherapy has a strong commitment to evidence-based practice. These innovations are reshaping the landscape of arthritic management. As a research and technology continue to advance, we can anticipate even more promising developments in the field of arthritic physiotherapy, offering a brighter future for those who seek to unlock their mobility and regain their quality of life. But even though, remember that the choice of therapy and treatment plan should be individualized based on the type of arthritis, severity of the arthritis, pain, and the patient-specific needs and goals. Should be according to that, you have to set the goals. Thank you for IAP Women's Cell, Kanchipuram District, President Pratibha Madam, and South Zone Head Janani Madam, our mentor Sanjuja Sir, and IAP President Ruchi Madam. Thank you for everyone given this wonderful opportunity. Any doubt is there in that after the presentation? Sorry for inconvenience. 3 times, I think 3 or 4 times internet problem. I disconnected and again I logged in and shared the screen. Sorry, madam. Sorry for the inconvenience.
That's okay, sir. That's okay, sir. No issues, sir. Apart from the internet interruption issues, the presentation went on well, sir. Thank you for this wonderful presentation. Thank you. Thank you, sir.
Thank you so much.
Thank you, sir. Yes, sir. Actually, arthritis was well explained, and I hope everyone have a take-home message. Actually, from the first presentation by Senthil sir, Sir actually explained well about this primary, secondary, tertiary prevention of arthritis was really explained well. And from Dr. Kumaresan sir's presentation from Savita College of Physiotherapy, how assessing and then deciding the management after diagnosing was really explained well with this AI, how we differentiate, we can maintain we can check with the joint space narrowing and assessing well. And also the diet, which would be really helpful, how to maintain and avoid and to progress arthritis to getting it to down. So really, it was really helpful session, sir. Thank you, sir.
Thank you,
And
madam.
surely, let's help our patients in prevention of the joint problems and managing the joint problems by assessing and making the proper diagnosis and proceed further with the proper treatment, physiotherapy treatment and physiotherapy management. And surely we'll all will be educating with proper scheduled exercise program as we prepare, as we prescribe exercises as a medicine. Movement is medicine, and it can be prescribed only by the certified physiotherapist. Thank you. Thanks a lot for everyone. And once again, I would like to thank our resource persons, Dr. Sendil sir, Chettinad College of Physiotherapy, and Dr. Kumaresan sir from Savita College of Physiotherapy for this wonderful session. Once again, I would like to thank Dr. Sanjay Keja sir, our Indian Association of Physiotherapy President, and Dr. Ruchivashni ma'am, Indian Association of Physiotherapy Treasurer, and Indian Association of Physiotherapy Women's Cell National Head. I would like to special thanks to Dr. Janni ma'am, our state head of Indian Association of Physiotherapy Women's Cell Tamil Nadu. And thank you, participants, and hope you all gain some knowledge regarding the role of our role in this field of physiotherapy. Do you have any doubt? Can also be mentioned in the chat box. I think we have some. Yes. Apart from general physiotherapy treatment, is there any physiotherapy techniques for arthritis? Yes, sir.
More in, ma'am. Any apart from?
I think treatment for arthritis. Question for you, sir.
General physiotherapy.
In the
Apart
chat
from
box.
general physiotherapy. That is what, ma'am. Nowadays,
Yeah.
we are incorporative neuromuscular exercises also. Neuromuscular exercises with use of the AI, virtual reality therapy and augmented reality therapy, we can use, ma'am, for arthritic condition also. Previously, it won't be there. Nowadays, we are going to use, and some of the case setting therapy also they are doing, correcting the deformity. Case setting therapy with use of the tilt table, we are fixing the joints. With that, it's almost a traditional one. Nowadays, it's becoming growing. This technique, case setting.
Yes, sir. Hope everyone is clear with the presentation. And thank you all, sir. Thank you so much. Thank you for the valuable time. Thank you, IIT India YouTube channel, and thanks to the social media of Indian Association of Physiotherapy. Thanks a lot.
Thank you, ma'am. Thank you so much.
Should we wind up the session, sir?
Yes, ma'am.
Yes. அங்கேயும் பிரச்சனை